Healthcare reform, also known as the Patient Protection and Affordable Care Act, or simply the Affordable Care Act, was signed into law on March 23, 2010. Its provisions became effective as early as June 2010 and continued to roll out till January 2020. By 2014, most Americans must have coverage. The general purpose of this act is to control health costs, expand coverage, make improvements to the Medicare program, improve training and development of health professionals, and increase funding for community health centers. It also includes tax credits for individuals and certain employers. This act affects businesses and individuals differently. The effect of this act on businesses really depends on the number of employees you have, and each provision's effective date varies. For small businesses with less than 25 employees and have average wages below $50,000 that provide coverage, they can receive credits up to 35%. In 2014, the credit increases to 50%. IRS.gov has guidance on these provisions and how to claim the credit. Small businesses with 50 or more full-time equivalent employees must have coverage or pay a penalty. Small businesses with less than 100 employees may use the market exchange to find lower priced plans. The market exchange is set up to accept enrollment beginning October 1st, 2013, and the coverage effective dates begin January 1st, 2014. Employers with more than 200 employees are required to automatically enroll employees unless they opt out of the coverage. The self-employed have the option to buy coverage similar to small businesses or individuals, but remember those premiums are deductible for tax purposes. To help employers get ready, you can follow these tips. You'll want to understand how your insurance coverage works with respect to premiums versus out-of-pocket costs, what services are covered, and what are the employer and employee costs. Learn about the different levels of coverage and find the right balance of cost and benefit. You'll want to consider preventative wellness programs to your employees. These programs may help reduce the premiums employers pay. And finally, consider consulting the experts to find you the best policy. I'm Olivia Campagnolo with Untracked Early.